Hi, I'm here today with Dr. Paul, who's chair of the Medical Imaging Department at the University of Western Ontario. And we're here to talk about dual energy imaging, and I'd like to ask you, so what are some of the key elements for a high performance dual energy imaging system?
So the sort of things I want to look at is, in order to have effective dual energy, you want a clean separation of the high and low energy beams. You don't want a dose penalty, right, because the patients don't need extra radiation dose. And I also want it to be very quick, because if you have too long a gap between the two acquisitions, patients will move, either breathe or have other sort of motion problems. Yeah.
Right. So this is interesting. So one of the things that we've implemented on our dual energy system is called differential filtration. So we use a different filter on the low and the high energy image, and that allows us to separate the spectrum in order to achieve that low dose image. And as you know, our DRX Plus detector is a high frame rate capable detector, and so we're able to get those two images as quickly as possible to minimize any kind of motion artifacts. Mm-hmm. So that in mind, what are some of the key applications that you would see for dual energy imaging?
So I'm a cardiothoracic radiologist, so clearly I'm going to look at that area of the body. One of the aspects of dual energy is to remove the overlying bony structures or to emphasize the bony structures. Mm-hmm. So when we remove overlying bone, we might want to look at underlying nodules or lung architecture that's obscured by the bone, particularly in the apices of the lung, where you have a lot of overlap between the costochondral junctions of the first and second, and that can obscure underlying pathology. And the opposite, where we emphasize bone, if somebody comes in with trauma, you can often pick up rib fractures that you've possibly missed on a conventional image. So those are two areas. But edges are also emphasized, so whether you're looking for a subtle pneumothorax, or you're looking for tubes or catheters, that's also something that can be emphasized depending on the material composition.
Great, so thank you for taking the time to speak with us today.
You're welcome.